Idaho Governor Brad Little, Director Jepson, and Judy Taylor, Administrator for the Idaho Commission on Aging. Before we get to our guests and the callers, I would like to give our listeners the opportunity to receive a complimentary copy of our new, and it is brand new because it's just getting printed right now, so the new Idaho Family Caregivers Resource Guide. And this guide, just so you know, that it's a resource guide that was put together by many partners, including the Idaho Commission on Aging, Boise State University, Idaho Caregiver Alliance, and so and it has information and resources from all over the state. So the guide is about 90 pages of local resources designed specifically for Idaho caregivers. It's information about financial resources, legal guidance, access to support systems, and much, much more. And really, there's nothing quite like it. If you would like a guide mailed directly to your home, right now you can press 1, okay? Press 1 on your keypad, and you will receive a free Idaho Caregiver Guide, which will be sent directly to your home. Again, this is just press number 1 on your keypad, and if you would like one in Spanish, you can press 2. So we are joined on the call today by Governor Little, Health and Welfare Director Dave Jepson, and Judy Taylor, Administrator for the Idaho Commission on Aging. Welcome and thank you all. We have, a really good team today to talk about many issues that are going on here in the state. Again, we're talking about Caregiver Month coming up here in just a few days, and the challenges that caregivers are having right now with COVID and still taking care of their families. And of course, Governor, you had an announcement yesterday, and we're back to stage 3 of the Rebound Idaho, so I'm sure that there are many questions about that, but I think it would be great to hear a little bit more from you as to what that means for Idahoans. And so again, in advance, before we even get started, I want to thank you, because I mentioned early in the call that this is our 25th. You've been on each one of those teletown halls, and it's so important because with so much uncertainty going on right now, and especially when we talk about the folks in rural communities, you have been the source of information, the most up-to-date information on what to do and what's going on, and also how to care for themselves. So again, welcome and thank you so much for your leadership, and the microphone is yours.
Well, thanks, Lupe, and thanks to all of you for calling in. You hit on a couple notes that I'll start off with, and I'll let Dave get into the details about going to stage 3. But you talked about the uncertainty, and I know on this call many times I've talked about the novel coronavirus, that what Director Jepson and I know about the coronavirus today is different than what we knew in March in a lot. And that's why it's important to have this venue. It deserves an explanation of what we've done in the past and why and what we. We're in the office that Director Jepson and I talk about as our, which is healthcare capacity, not only for anything that is critical for health. Treatment for a cesarean, a car accident, that we didn't have number of healthcare providers. We didn't have surge. It started in Blaine County. The day that we did the order for Blaine County, and then it was all over Idaho. But it is a global pandemic. Even Oregon and Washington, the are all in the orange or red area. Utah, Nevada, the Washington, It is truly a global. We are not going to eliminate COVID. What we're trying to do is manage it. And to go from stage 4 to stage 3 that guiding critical healthcare capacity. Our press conference, a doctor from the Magic Valley and the hospital here in Boise, and they made an excellent. We need to, every Idahoan, relative to a veteran, very can protect healthcare capacity for everyone, and opportunity to have the dialogue with people because of some of the it's credible to say there's mixed messages. Learn something new about the coronavirus, what we need to do about it as best we can in Idaho. I'm very proud of Idahoans for a lot of the sacrifices. Keep the economy going. If we want to keep our kids in school, keep people safe, we have to do those things that we let Director Jepson talk about some of the changes. We're trying to reduce the transmission, and that's why we've changed the criteria for gatherings. We've given some more guidance to long-term care facilities, which I know we'll talk about, and we're just trying to best manage this we can as we go into fall, and the big risk areas are people are inside more, the flu season starts, and kids are back in school. So with that, Lupe, I'll let Dave dive into the details a little more.
Well, Governor, thank you so much for those remarks. Director Jepson.
Thank you, Lupe. Thank you, Governor. Happy to add a little bit of color to the Governor's comments there. So I'll start with hospitalizations. As you heard at the press conference yesterday, and the Governor described so well, we've really seen a pretty significant change in our hospital capacity over the last week or so. Our last data point says that we're about 270 COVID patients in the hospital and about 75 in the ICU. That's our highest numbers we've ever seen so far in the pandemic. And as the Governor mentioned and articulated so well, what that really means is that's eaten into the capacity for everything else that the hospitals do, including down in Twin Falls, where they had to shut down their pediatrics unit and move all their pediatric patients up to Boise to save room for COVID patients. And that's a situation that all of us will want to avoid, is where we have impacts to our capacity on healthcare. And obviously the numbers that lead up to that continue to increase. The number of cases, the number of the testing positivity are all leading indicators against that hospital capacity line. And so I would just make a few comments about a phrase that I've stolen shamelessly from the Governor, which is transmissible moments. And I think that the best thing that all of us can do, and you've heard the Governor say it every time he speaks, is to minimize those transmissible moments. That's where the danger is. And it's really quite simple. Washing your hands. And in the new state that it's required that for non-household members. And the reason for that is we know face coverings and slows down the transmission. We know we're not going to slow down the transmission and don't risk our healthcare capacity. And as we look at the data for where current cases are coming from, they're not coming from classrooms. They're not coming from people going to the grocery store. It's really in those social settings. It's the sporting events. It's going to church. It's community events. It's getting in a car with people that aren't in your household. It's the family gathering or the wedding or the funeral. And I think what happens there is we tend to be familiar in those events, and we tend to forget to follow those couple of simple things, and we end up sitting closer than 6 feet without a face covering, and that's where that happens. And so we can still do those things. There's new guidance around 50 people indoors. 25% capacity in outdoor events or stadiums. So we can still do those things safely, but they have to be done safely. And particularly when it's familiar, when it's with friends and family, it's really easy to let your guard down. And speaking of that, I would encourage all of us to start thinking about our plans for Thanksgiving and Christmas. The CDC has some excellent advice out on their website for holidays that is really, I'd encourage everyone to go take a look at it and really highlights ways to completely and thoroughly enjoy the holidays, but do that in a way that doesn't leave any of your family members sick or afflicted with this terrible virus. So I direct your attention to that. So I would just close with another request and plea to please make sure to follow those simple things, particularly when you're in a familiar environment. And if we do that, we know that that will turn the tide on our hospitalizations. It takes about 2 weeks for any of these actions to take place, and will not threaten our ability to give hospital care and health care to the citizens of Idaho. So with that, Lupe, I'll throw it back to you.
Oh, Director Jepson, thank you so much for that information. And we will now turn to Judy Taylor, Administrator for the Idaho Commission on Aging, to discuss how this pandemic has multiplied the challenges for family caregivers and share with us resources available to help. Judy, how has the pandemic impacted the work you and your staff do at the Idaho Commission on Aging? What can caregivers do to take care of themselves so that they can continue taking care of those that they love, their family members?
Well, Lupe, before COVID-19 happened, our biggest challenge around caregivers was having Idahoans not even understand they are caregivers. We have a huge spirit of self-reliance, taking care of our own problems within our communities, and we often had parents and husbands and wives and believed they were just doing the right thing, taking care, raise their hands and say, I am a caregiver. Understand you are a caregiver along with concern to neighbor. You can't get the help and support. One of the silver linings of COVID, truly going it alone and isolated, understand that they are caregivers, heavy responsibility, and care of those that we love and live in our communities in a privilege, but everyone needs and deserves it. They are barrier between whoever they're caring to go into an institution, and none of us. One of the things we hope people understand, this period of isolation alone, and it helps everyone when I do have might be listening, and the first help. I understand people turn, and I think that your caregiving guide, and I commend AARP for that. It's such a state. I want to give people, one is our website, and that's www.idaho.gov. Please make sure that you go to the .com site. Unfortunately, website out there. So on our website, you're going to find all out. And one of the most important things that shows you your local area agency on aging. One of the things we know about support is it needs to be built into the community where you out to your local area agency on aging. Biggest piece of advice. My others is to pick up the phone, put on a mask fence with your neighbor, call your past, need each other, and caregivers have to reach out every day besides the person they're caring for. Caregivers are doing a lot more things for the people they care for. AARP on the national level has partnered with the Home Alone Alliance, and they have fabulous resources and videos about how to do a lot of these procedures and skills that in the past only nurses knew how to do. On our website, under our Stay Educated section, we have a whole page dedicated to sending people to that resource around how to do some of these important skills and do them well. And lastly, don't neglect your own health. Again, caregivers are that important last barrier between the person they're caring for and institutionalization that all crumbles if you yourself get sick. So please, get some fresh air and some exercise and some fresh fruits and vegetables, and don't put off your preventative health care. And you know, even during COVID-19, all of these things can be accomplished safely. So there it is, my best advice and my thanks for the caregivers of Idaho.
And thank you so much, Judy. And you are so right that people caring for families, they see it as it's the labor of love, you know, and they do not see themselves as a caregiver. And we have almost 200,000 here in the state that are doing this work. And the only challenge is that if the caregiver gets sick, you know, then you're looking at what happens to the loved one that they're caring for, because if that caregiver is out of the picture, then you're looking at some type of long-term care facility to take over that work, which is very expensive for one, you know, and folks prefer to stay at home for as long as they're able to. So great information. And again, all of you folks, remember, our caregivers, we've all been caregivers. We've cared for our children, we've cared for our parents, we've cared for our friends. And so, and if you haven't been a caregiver, or if you're not one today, I assure you, you will be one in the future. So all of the resources that are available, you heard Judy on the website, and the information that her office has to offer. And you can also, again, it's still, so you can press *1 on your, just press 1 on your keypad. Now we're going to go to the phones. We're going to answering some of the questions that you all have and concerns that Idahoans are having from across the state. So, again, Little for Administrator Judy or for Director Jepson, you need to press, to ask a question, it is *3, okay? *3 on your telephone keypad to ask a question. You can do this anytime during the call. With that, we're going to go to Julie from Lenore. Julie, good afternoon and welcome. Hello, Julie.
Good for safety that we're moving back to stage 3, Governor Little. But recently in the Idaho Statesman, you said, quote, Idaho is at a critical juncture. This is unacceptable and we must do better, end quote. So, Governor, why aren't you willing to really help protect the people of Idaho, those who elected you and those who want to trust you, and require a mask for everyone? Thank you for your response.
Well, Julie, once again, I think Lenore has the highest per capita participation in the AARP call. That is a direct quote. But my belief, honed through years of being a regular citizen and now as an elected official, is that the compliance is often directly proportional to how close to the citizen the suggestion, the edict, or perhaps even the mandate comes from. Right now, and that has changed a little bit in the last week, but over half the state has got a mandate. Having a mandate is one thing, having it applied is unfortunately a different thing. My goal isn't to aggregate power in the governor's office or aggregate power in Washington, D.C. I want people to be safe. I want the people of Idaho to recognize the magnitude of this problem and to step up and even if you don't have a mandate, and that's why we changed our press conference yesterday from what we've had before by having doctors, both the Veterans Hospital and the Magic Valley Hospital that Director Jepson just alluded to, making the case. I think the Lewiston Hospital's okay, but just north of Lenore, almost all of you're actually surrounded by it. Shoshone County, Kellogg, Wallace, because they all rely on Kootenai capacity, and we're in the unenviable position on hospitals in the state of Washington. I just believe that and then local of it, and they need to listen to their but their doctors, their hospitals, they're doing that hard work in the long-term care. What we can do to keep that infection level down makes everybody governmental philosophical area that I have support action by every health district in what.
Okay, thank you very much. Here in Boise, Steve, good afternoon.
Thank you. I don't, but it seems like the total change limit indoor groups to 50. Other than that, I don't know that I'm seeing this. So I'm afraid that we continue to climb. And I'm wondering what, I just want to know that we have a plan it does not result in a decline in the number of.
Well, Steve, what we do today will impact, and I think the awareness is a big part of it. That people are aware, and Director Jepson talked about it. The big part of stage 3 is the fact that we're trying to minimize the spread in those gatherings. The school districts are working feverishly to minimize the spread that takes place in their areas. The healthcare industry is working feverishly, but as Dave alluded to, if we can minimize the spread out of those gatherings, whether they be indoor or outdoor, whether they be in bars, restaurants, or nightclubs, we believe that will do what we want to do, which is suppress that curve to where we'll have more extra healthcare capacity, particularly as the flu season starts, as people go inside, as we probably have more spread from schools and higher learning institutions. I've been very pleased. I was reading the numbers this morning, what's taken place. Our higher education learning facilities where we had a big spike in cases, their education, their testing, they're proving that we can do this. But our weak link has been these gatherings, and that's why that was the biggest part of moving to stage 3. Going forward, my goal is that we go to stage 4 and maybe even move out of it, that the education of the people of Idaho will be successful. And I think when people know that, they may know some young person that had COVID and the symptoms were either non-existent or very mild, but when they start thinking if something happens to a loved one and they can't get into a hospital, that is really going to elevate what I think is a very core Idaho that's in our ethos, is to try and help our neighbors.
Director Jepson, anything to add?
Yeah, I would just echo what the governor said there, which is where we know the spread is taking place right now is through gatherings, particularly gatherings where people feel comfortable and familiar. And so that's why that stage 3 order is really critical of requiring 6 feet of space between non and then also requiring a mask mandate in long-term care centers. We know that in long-term care centers, when you get a case in there, it's really hard to control. All those cases come in from the outside, and so if we can slow down that spread, is where we have over 110 long-term care centers as of today with outbreaks, and that is our most vulnerable population. So that's really the ethos of stage 3. Is around it starts with those gatherings, and then it spreads into places we don't want it to go.
So speaking about long-term care facilities and the stage 3 and some few more requirements to keep people safe, what can you maybe and either you, Judy, Governor, Director Jepson, can you maybe provide folks out there who have loved ones in some of the long-term care facilities as to how do they still visit? How do they keep them safe? How do you prevent isolation?
I'll start off, and then I'll let Dave or maybe Judy chime in. We recognized early on the consequences of loved ones not being able to have a dialogue, to express their love and appreciation. And so we've worked, and that was one of the reasons that one of the mandates in this order was that, most of them were, but we wanted to make it unequivocal that in the long-term care facility, face coverings were essential. Some facilities are just better built for it. They can isolate visitors out, so many of them, you walk through the front door and you're in the biggest area where people eat and everything else. And, some of them that we've gone to put tents outside and put other facilities. Some of them allowed for iPads for people to dialogue. But as we know, as winter comes to Idaho, that gets to be more challenging. But there have been a lot of modifications to long-term care facilities to allow that. They're the most susceptible population we have, our long-term care facilities and nursing homes, because they're the most health compromised and most susceptible to it. We want to keep them safe, but we also want to keep that up. Dave, do you want to add anything to that?
Yeah, thank you, Governor, and I think Judy may want to add something as well. But I would just say that there are many things about this pandemic that just make my heart hurt. And one of them is those poor folks and residents in long-term care centers who are separated from their families. And I can't imagine how difficult that is for them and their families. And so in this order, we have not prohibited. In fact, nowhere in the state of Idaho is it prohibited for visits to long-term care centers. Rather, what we've done is to say, please do that safely. It's equally as important that we protect their physical health as well as their mental health. And so that's why that mask mandate went into place for the long-term care centers. We know that virus comes in from the outside there, and we also know that we need to have visits take place for these folks. It's important to the family, to the residents, and it matters a lot. There is guidance out. We have guidance out for how to do that safely on our website, on the coronavirus.idaho.gov website and the rebound.idaho.gov website. Obviously, if there's an outbreak taking place in a facility, that facility needs to take the steps to protect the residents appropriately. But if at all possible, we are strongly encouraging for safe visitation to take place at long-term care centers.
We have like so many questions here, and anything to add to that?
I just wanted to say that our local ombudsman and volunteer long-term care residents have been shut out of facilities.
Okay.
In the meantime, they went through PPE plan. As soon as that restriction lifted, they are now in facilities, visit with residents, and their rights are being violated. If you do have a one and want to speak with our ombudsman, let me give you our phone number. It is area code 208-334-3833. The number, it can connect you with anything you need, but certainly we can get you in touch with your local ombudsman. 208-334-3833.
Thank you so much. Again, a reminder that if you would like to get a caregiver guide, press 1 for an English guide, and 2 if you want one in Spanish. So again, press 1 to get a guide in the mail, or 2 if you would like to have one in Spanish. Now we're going to go to Elaine in Preston. Elaine, good afternoon. Welcome.
Hi. I don't know if this call is even necessary, but I'd rather ask a question and be thoughtful than not ask it and prove it. One of my family members has had my car for over a month, and he's been diagnosed with coronavirus. If it's detailed, is that going to take care of any fear? Or do I have to have it done one-on-one?
From the beginning, that surfaces were clean, but from a magnitudinal standpoint, way over. I want to add to that.
I would just echo what that said, and less transmission taking place from touching surfaces sit for a day or two. The virus doesn't do a car surface, and so yeah, I think detailed if you want, but I think that you should be cleaning or have someone give it a good cleaning.
We will now go to Mark in Pocatello. Mark.
Hi, thank you for taking my call. Governor, do over the few months, I know it's not easy. These half-baked measures, I know it. Everybody listening on this phone. Ago, I had a kidney issue, and on an ambulance at 1 o'clock in the morning, sent up to Idaho Falls from Pocatello because the Pocatello hospital was completely full. And the Idaho Falls hospital was telling me that they were just about full. You keep asking people, wear a mask, social distance, yada, yada, yada. They're not listening. You're the adult in the room. What is the tipping point? At what point do you say, okay, kids, now we're going to tell you what to do? Because, like I say, these half-baked measures are not working. Things are just getting worse. And I understand the economic ramifications, but like I tell people, would you rather be broke or would you rather be dead? Because if you're broke, there's a chance you can recover. If you're dead or if a loved one is dead, that's it. And again, I appreciate your efforts, Governor, but I am curious, what is the tipping point for you?
Well, Mark, obviously, what we talked about yesterday and what Dave and I talked about this morning is one of the tipping point issues. But But as we've seen, and as I stated earlier, half of Idaho, particularly the areas where there's a lot of spread, have mandates. Having a mandate is one thing. Having people comply with it is quite different. And so that's why we're doing all the outreach we can. And your case is a very good case. I will tell you that most people don't realize the magnitude of it like you do. And that's why we did the press conference we did yesterday. And we're seeing more of it broader. It's awareness of people and the fact that those little sacrifices they make, particularly in these small gatherings, are going to make a difference. So we are at that tipping point. But having the mandate is one thing. Having people comply with it is totally different. And what we want is people doing the right thing, mandate or no mandate. But a lot of it is awareness, and that's why we're thankful for this call.
And thank you very much. Again, if you just joined the call, my name is Lupe Whistle, State Director for AARP Idaho, and you're listening to a telephone town hall with our guest, Governor Brad Little, Health and Welfare Director, Dave Jepson, and Administrator of the Idaho Commission on Aging, Judy Taylor. So, and they're answering questions about coronavirus and caregiving. So again, if you want to ask a question, press *3 on your telephone keypad. And a reminder that if you would like to get a caregiver guide, press 1. If you want a Spanish one, press 2. Now we're going to go to Bob in Sagal. Bob, good afternoon.
Yes, thank you. Idaho has led the nation in the percentage of deaths associated with seniors. We're over 94%. Being number one is not really a good thing to brag about. I've called the governor and asked what can we do here where I live, because our politicians here have no interest in trying to curb the pandemic whatsoever, and our cases just keep going on a steep curve. Every day since April hasn't slowed down one bit. I called a PhD, and they said, well, yeah, our politicians just don't believe that COVID's a problem, so they're not going to do anything. It frustrates the heck out of them. You're on your own, I guess. There's no programs here to offer shut-ins for any things like groceries or anything like that. There's just no care here. What do seniors do? You've abdicated your responsibility to the locals, and locals just don't care.
Well, I want Judy to talk about some of the programs that are available, but I don't have a statewide health policy police force. That's why I absolutely have to get the buy-in of local communities. Just yesterday, it doesn't go all the way up to Sagal, but you saw what the city of Coeur d'Alene did, and in fact, Sagal was under a mask mandate. And so if you have a mask mandate and nobody complies with it, nobody enforces with it, that's why we continue to put out the message and try and get more compliance. I think the awareness, because of the critical nature of the fact that the Kootenai health area is out of capacity, is going to change behavior, it's going to change awareness. And I'm hopeful and prayerful, but I can't deploy resources that don't even exist unless the local community gets a buy-in, and that's what we're doing. Judy?
Yes, hi there. Thank you for your call. I want to share with you the direct number of our area agency on aging in your area. So if you have a pen, that number is 208-667-3179. 208-667-3179. And I assure you that there are services for our older shut-ins. That's why the Commission on Aging exists, and we're very proud of the job we can do. So please reach out, call that number, and see what's available in your community.
Okay. Again, I'm going to remind you that also for those of you, all the listeners, if you have a friend, relative that would like to, can use an Idaho Caregiver Guide, just press 1 on your telephone keypad, 1. and 2 if you want it in Spanish. Now we're going to go to Betty in Nampa. Betty, good afternoon.
Good afternoon. I see when I go to the grocery stores, or I went to a funeral Saturday, they go in with masks on and they take them off. They took them off at the funeral. So, yeah, they wear them to the event and they take them off. So unless there is a mandate and something as a deterrent, what good is it to say wear a mask? You've got to put some meat behind this and say do something or there's a consequence. It's like with little children. You're going to stand in a corner and there's going to be a consequence for something if you do it. These are adults that don't do it, but you've got to do something, Governor, that says there's a consequence if you don't. Because I have no immune system at all, and it scares me to death when I have to send my sons in to a grocery store to get something because I'm afraid of what they're bringing back. I sat in the car at the funeral and watched from a distance. It was a graveside, but it scares me. Thank you so much for your reply.
David, do you want to address that? If you're immune compromised or you're sensitive at all, you did exactly the right thing. And we know that our contact tracers from grocery stores, now obviously hand sanitizing as you come out, that there's very little spread there. But you are right about the kind of that people taking their masks off, particularly for a period of time. Generally, 15 minutes is the amount of time.
Yeah, Governor, thank you. And you are spot on. Spread is in these events where it's very, and you haven't, it's not somebody around all the time, and over around the state, which is that you show up, take their mask off and want to socialize because that's what you do. Would echo what the governor said and what I've said is a critical place to minimize those transmissible moments. It's going to take all of us to remind each other, particularly at those gatherings that you're describing. We can do those safely, but everybody has to follow those very. Betty and others exactly like you who be part of those family events and want to be part of those social experiences. Precautions in place to protect them. So I just would. Really, the point of the Stage 3 order is around making.
Thank you. We will now go to Maxine. Good afternoon.
I had a question, but first a remark. I live in Lincoln. Had a big increase just within the last. And I really think can be done about it. But Twin Falls County had the big, small surrounding communities go to that. Right? But I think they should not have done that. Now I'm asking. We had like a couple of days ago, and about 5 or 6 that have had the. I'm asking about quarantine. And they took several children out of school. We had students around them. But then in one of the local communities, in a restaurant. Now, what is the rule on quarantine? Aren't those people supposed to stay home?
Exactly. They are supposed to stay home, and and you, Maxine, obviously are very acutely aware of the risk. And I believe, having been in Idaho all my life, that Director Jepson and I, since March, have been talking about healthcare capacity. We now have concrete evidence about when we have this large spread that we do have healthcare capacity risks, significant risks. I had a call from the governor of Washington Friday about what was taking place. But I am confident that I just hope their behavior modifies fast enough to keep us out of the next level. And I believe they will. But you're right, if somebody's in quarantine and they're out. Now, if you're in quarantine and you're not for a long period of time, the risk is a little less. But quarantine is quarantine. You're not supposed to be in a position to where you're going to spread the virus, and that's a violation of quarantine. But as you can imagine, Lincoln County would be a great example. There's just not a lot of healthcare police there to warrant that, and a lot of it is going to be peer pressure from their neighbors about you got to do the right thing so we can keep our kids in school, so the economy will rebound, and most importantly, so we can keep our vulnerable safe.
Great, thank you. We will now go to Pat in Kuskia.
Yep.
Pat, good afternoon.
Okay, good afternoon. First off, I'll just, so it comes out clear on things, I didn't vote for the governor, voted for Paulette Jordan, but think the governor is doing a real good job. And when people keep calling and asking, I guess you're there, people keep calling and saying, why isn't there a mandate on masks or anything like that? One of the problems is conspiracy theories. I'm in Idaho County, and boy, there's really lots of conspiracies there. I went downtown today, and I talked to people about mask wearing. One person said, you got to wash it quick, or else it'll make everybody sick because they got the carbon, breathing back the carbon. I talked to another one that said that day after the election, Hillary and George Soros are going to flip a worldwide switch, and there will be no more coronavirus in the world. And talked to another one that said, no, as soon as they get the vaccine, then Bill Gates is going to have this chip, and it's going to people, it's going to control everybody. When there is so much of that going on, and even in our county, there was a big push to recall the governor because people didn't like any kind of the mandates of any kind. So if we could, so information and misinformation is a big problem. And I don't really am asking a question. I just want to tell you that.
Well, thank you, Pat. Like I said, we realize that the burden on us, not only the Director Jepson and I and my coronavirus working group, but the health districts and local leaders, is to dispel, and as I said at the onset, because this is a novel coronavirus and things have changed, it has created an atmosphere where some of that distrust and some of those conspiracy theories have some level of credence. Some of them are a little further out than other ones. But now that we have the evidence that our healthcare capacity is at risk, I am hopeful that people will modify their behavior to take care of them, as I said, the economy, their neighbors, themselves, and keeping our kids in school. So thanks, Pat.
All right, we will go now to Jack in Twin Falls. Jack, good afternoon.
Hello. So my name is Jack Schemmel, reporter with KMVT in Twin Falls. And I know the governor talked a bit about it earlier, and some of the colleagues on the call did as well, about long-term care facilities as well as mental health. I just wanted to, because I was kind of all when this was discussed, other than a mask mandate, is there anything different about long-term facilities right now? That's more for the governor, as well as you touched on the mental health aspect of it. You want to have people to have the opportunity to see, their loved ones. How important is the mental health aspect of that situation?
Well, Jack, I'll let Dave talk about it. He talked about it a little bit earlier, but we recognize the really fine line between, people's social, emotional, mental health and keeping them safe. They're the most at-risk population, so it's really a fine line, but we have to keep the spread out, and it's usually a member of the staff, so there's lots of testing that we didn't have before, and now we've got point-of-care testing in, I think, all those facilities, which is a big deal. If we can test, and I anticipate the day to where there'll be a rapid test. Hopefully there'll be a vaccine before this will be available, that if you want to see somebody in a long-term care facility, you can get tested in 15 minutes, we'll have a result. We have those tests now. They're not as good as we'd like to have them. The people that do testing, every day it gets better and gets more available and it gets more affordable. But testing, basically changing how we, the physical makeup, barriers, isolation areas to where there's people and talk to their loved ones there, but we've got, some of them are perfect for it, and some of them stay on to that.
Yes, and thank you, Jack. Nowhere in the state of Idaho is there long-term care facilities. There is guidance. As you mentioned, and the governor mentioned, it's so place because it's so critical to the mental health and the social health of residents as well as the families. And there is the federal agencies, the Center for Medicaid and Medicare Services, Idaho.gov site of how to do that. Each facility to decide when visitation is allowed or not. If you have a large outbreak, it is probably not safe to have visits. But wherever possible, we're strongly encouraging that safe visitation take place. Contract with two different entities to provide rapid testing at long-term care facilities across. That be a barrier to making sure that we know that the staff are safe. Virus out of the facility, we can keep visits going, along with PPE and others in the long-term care centers.
So we're going to go to, let me see. Kathy, go ahead.
Hi, Governor Little and Director Jepson, and thanks so much, AARP, for supporting this. This is the second call, and I never really got an answer because I kind of raised two questions. You've got the public health emergency money. There's been I think there's confusion. The speaker from Kuski that called in, he's right spot on. I was up around that area, and I was at a wedding, and I'm here to say that I've got immunity issues, and my husband and I had on our mask, and we're at a wedding, and come to find out, we were about 8 feet at the end having a conversation, and they had their masks on. They were from Seattle. 2 of those people came down with COVID that Monday, and it was Saturday. And I'm happy to say we didn't get it, and we're really being diligent. But what my impetus here, before we run out of time, can't we spend some of that PHE and billboards to the fellow in Kuski? I'm very intelligent. Who goes with that? My immune system. We've had kind of trying to make it was at first political. We need to have some experts. We need to have some hard-hitting commercials, inaccuracies, and people, I've seen it on the internet, carding out votes that don't even know what they're talking about. Can't we have, the divided states and have some experts? Commercials right now are trotting out experts, which is really good. Gosh, that's political. So if it Governor Little, I think we could get this vaccine comes out. We've had Redfield say, so we still need to wear masks. Thanks.
Thanks, Kathy. Real briefly, we're at the end, about the end, but a PSA 6 months. Partners in healthcare, a lot of businesses have done it. Our modern society from lots of different sources, and try and reach have very additional methods of getting information of media. It's gotten way too political. We can health and welfare, the health districts. We all want to do the same thing, but it's a little people get their information in.
So much. Again, this has been an very informative discussion. I mean, very busy. I know we have many we did not get to. But I on the phone. Again, Caregiver Month book that you can really use. Any one, and we will mail one to you. So again, press 1 if you would like a caregiver guide. Closing remarks?
David, do all those things. Do your distancing. Wear your face covering. Particularly those of you that are at risk. Be very careful because we are at a different time now. Our healthcare capacity is being taxed. I have great confidence in the people of Idaho, but we want to do all we can to make people to be aware. I believe most people on these calls reflect, understand the magnitude of the problem. And if you and your neighbors and your friends all do the right thing, we'll get through this.
Thank you so much. I want to thank Governor Little, Director Jepson, Administrator Taylor for taking time out of their very busy schedules to speak to our callers today and answer their questions. I really want to thank all of you on the phone, all of you on Facebook who have been participating week after week or every 2 weeks. Thank you all. Again, November is Caregiver Month, but you know what? Every day is caregivers' duty. So I want to thank all the caregivers that are listening for your labor of love. Just a quick reminder that if you want to find the latest updates on coronavirus, as well as information tailored to older adults and family caregivers, go to aarp.org/coronavirus, or you can go to coronavirus.idaho.gov. And again, if we did not get to your call, we apologize, but we will be back in 2 weeks, and we will have, of course, the governor and probably Director Jepson and someone else that we don't know yet, so to be determined. Again, if you would like to get a caregiver guide, right now is your chance to get one mailed to you, and it's just press 1 on your keypad. With that, I say have a wonderful day, and thank you for joining us.